The effectiveness of mindfulness-based stress reduction on the psychological functioning of healthcare professionals. A systematic review. This was published online. The authors being Sarah Caracas, Katie Ann Elliott, Colleen Lammers, and Robin Owen. This was published in the National Library of Medicine, National Institute of Health. Abstract. Objectives. Burnout and occupational stress are frequently experienced by healthcare professionals, HCPs. Mindfulness-based stress reduction, MBSR, has been found to improve the psychological health outcomes of healthcare professionals. To date, systematic reviews and meta-analysis have primarily focused upon empirical investigations into the reduction of stress among HCPs using MBSR, and are limited to empirical studies published before December 2019. This systematic review aimed to update the current evidence base and broaden our understanding of the effectiveness of MBSR on improving the psychological functioning of healthcare professionals. Methods. 3 electronic databases, Medline, PsycInfo, and Web of Science, were searched without time frame restrictions. Quantitative studies include randomized controlled trials, clinical controlled trials, pre-post designs, and studies with up to 12-month follow-up period. All studies including in the review employed an MBSR program, standardized measures of psychological functioning, and qualified healthcare professionals as participants. Using the PRISMA guidelines, 30 studies were included in the review. The reviewed literature suggested that MBSR was effective in reducing healthcare professionals' experiences of anxiety, depression, and stress. MBSR was also found to be effective in increasing HCP levels of mindfulness and self-compassion. However, MBSR did not appear to be as effective in reducing burnout or improving resilience amongst healthcare professionals. Abbreviated MBSR programs were found to be as effective as the traditional 8-week MBSR programs. Conclusion. MBSR is an effective intervention which can help improve the psychological functioning of healthcare professionals. Recommendations include improving the overall quality of the studies by employing more robust control designs with randomization, increased sample sizes with heterogeneous samples, and making comparisons between interventions used. Healthcare professionals are exposed to emotionally challenging and stressful situations in the workplace, particularly in the current climate, with an increased demand for clinical productivity and other work-related pressures. Occupational stress and burnout are common amongst different healthcare professionals, including nurses, physicians, and psychologists. Stress can be defined as a relationship between an individual and their environment, which the individual appraises as potentially threatening to their well-being. In relation to burnout, there does not appear to be a universally agreed definition. However, burnout can be viewed as a process rather than a fixed state, and defined as emotional, mental, and physical exhaustion caused by excessive and prolonged stress. In relation to employment, Marslak and others developed a model of burnout that they described as a work-related syndrome with 3 components. 1. Emotional exhaustion. 2. Depersonalization. And 3. Diminished feelings of personal accomplishment. Emotional exhaustion refers to employees having reduced ability to experience emotions relating to their work. Depersonalization is a process which involves employees distancing themselves from their patients by disregarding the characteristics that make them unique. Personal accomplishment relates to employees' feelings of achievement from working with patients. Occupational stress and burnout among HCPs have been associated with physical and mental health problems, including anxiety, depression, diabetes, fatigue, heart disease, hypertension, insomnia, and obesity. Burnout among HCPs has also been associated with reduced job satisfaction and negative patient outcomes, including reduced patient satisfaction and increased work errors. There's a growing body of research evidence that has suggested that mindfulness-based interventions, MBIs, can help decrease stress and burnout experienced among healthcare professionals, increase job satisfaction levels, and improve patient outcomes. Although there are varying definitions of mindfulness, it is commonly and operationally defined as the quality of awareness that occurs through intentionally focusing on present moment experiences in an accepting and non-judgmental manner. Kabat-Zinn, 1994. Mindfulness has become an increasingly popular psychological intervention worldwide. It has an extensive and well-established evidence base, which has investigated the efficacy of MBIs to improve the psychological functioning and well-being in both clinical and non-clinical populations. There are numerous MBIs that are currently being employed with clinical and non-clinical populations. However, mindfulness-based stress reduction is one of the most extensively used and evaluated MBIs. Mindfulness-based stress reduction was originally designed for patients with chronic medical conditions to help reduce stress and improve their quality of life via focused attention, meditation, cognitive restructuring, and adaptive learning techniques. Kabat-Zinn, 2013. The standard MBSR program is an 8-week group intervention where participants meet once weekly for a 2 to 3 hour and undertake a 6-hour silent retreat. Participants are encouraged to complete 45 minutes of daily mindfulness practice to aid skill generalization. Mindfulness practices are taught via formal practices. Example: body scan, sitting meditation, mindful walking, and hatha yoga, and informal practices, whereby individuals are instructed to mindfully engage in typically mindless tasks, such as brushing teeth and washing dishes. There are numerous theoretical models to explain the potential mechanisms of mindfulness and MBIs. A similarity of many of the models is that they postulate that mindfulness causes a positive shift in perspective and an ability to objectively view one's life experiences, which is often referred to as decentering. Shapiro and others in 2006 highlighted a mindfulness including 3 interwoven mechanisms that form part of a single cyclical process. 1. Intention, or on purpose. 2. Attention, paying attention. And 3. Attitude, with openness and non-judgment. Furthermore, these 3 mechanisms of mindfulness are conceptualized as a single cyclical process and lead to the aforementioned shift in perspective, which Shapiro and others refer to as reperceiving. Reperceiving facilitates an individual's ability to observe their thoughts and feelings with greater clarity. Reperceiving is classified as a meta-mechanism that then leads to an additional 4 mechanisms. 1. Self-regulation. 2. Values clarification. 3. Cognitive, emotional, and behavioral flexibility. And 4. Exposure to strong emotions with objectivity. These additional mechanisms result in changes which then produce positive outcomes. For example, more adaptive coping and reduction in stress. Kabat-Zinn suggested that individuals can react to stress in a habitually unhealthy way. These feelings and behaviors are referred to as habitual or automatic stress reaction. Kabat-Zinn further highlighted that mindfulness can help individuals employ a mindfulness-mediated stress response. This process enables individuals to engage in the process of re-perceiving. This then reduces the power of the stress reaction, and consequently, individuals can employ more adaptive, effective coping strategies, which in turn reduces stress. With regard to HCPs, the practice of mindfulness encourages a person to check in with their inner experiences and to better understand their personal strengths, difficulties, and best contributions. Bishop and others proposed a 2-component model of mindfulness: self-regulation of attention and acceptance of one's own experiences, or non-reactive awareness. Arguably, non-reactive awareness may help HCPs facilitate the process of decentering and reperceiving in the workplace. With the development of such skills, healthcare professionals could better manage stress and thus reduce stress and burnout levels. Over the past decade, research attention has increasingly focused upon the effectiveness and utility of MBSR programs, and several systematic reviews and meta-analysis have been completed. For example, 2 reviews conducted with a population of healthy adults concluded that, despite available studies being flawed with methodological limitations, MBSR was efficacious in reducing both anxiety and stress and in increasing self-compassion. Similarly, a meta-analysis concluded that brief versions, example 4 to 6 weeks, of MBSR were equally as effective in reducing psychological distress in working adults compared with the MBSR originally designed for clinical populations. Specific reviews have investigated the effectiveness of MBIs on the psychological functioning of healthcare professionals and have concluded that MBIs were effective in increasing mindfulness and self-compassion and reducing anxiety, burnout, stress, and rumination. However, MBIs included in these reviews were not all based on MBSR. There were a mixture of qualitative and quantitative studies, and the samples included specific groups of HCPs, example nurses. Therefore, the variability of the studies suggested that there was a need for future reviews to focus specifically on the effectiveness on MBSR on the psychological outcomes of different groups of HCPs. Consistent with this, Irving and others undertook a review of 10 empirical studies examining the potential benefits of MBSR in improving well-being and coping with stress among HCPs. From the 10 quantitative studies reviewed, Irving and others in 2009 found that MBSR consistently reduced anxiety, emotional exhaustion, and stress, while also increasing positive affect. However, the review only published studies until 2007, and many of the studies were noted to have methodological shortcomings, such as small sample sizes, and only one study included an additional treatment comparison. A systematic review and meta-analysis by Burton and others in 2017 included 7 studies which focused on the benefits of MBIs reducing stress in healthcare professionals. Finding from this review suggested that MBIs had the potential to significantly reduce stress experienced by healthcare professionals. Although the authors argued that the quality of some studies proved high with regard to their clarity of aims, data collection, and analysis. They also found that some studies continued to present with methodological shortcomings, including small sample sizes and limited use of theoretical frameworks. It was concluded that future research needed to investigate the sustaining effects of mindfulness training on stress experienced among healthcare professionals. The review included studies published before August 2015. More recently, Lamas and others in 2019 completed a systematic review and meta-analysis of 41 studies, which had investigated the effectiveness of MBIs on healthcare professionals' well-being and included both negative, anxiety, depression, and stress, and positive, life satisfaction and emotional intelligence outcome measures. The review concluded that MBIs were associated with positive outcomes in relation to most measures collected, and appeared to improve the well-being of healthcare professionals. However, the quality of the studies proved inconsistent, and future high-quality randomized control studies were recommended. The review included studies published before January 2016. Furthermore, Bruce and Fernandez and others in 2019 also completed a systematic review and meta-analysis of 6 controlled studies, which investigated the effectiveness of types of NBIs in reducing stress and improving self-compassion and mindfulness among healthcare professionals. The review highlighted that MBSR was the most commonly used type of MBI. Consistently, MBIs were found to reduce stress experienced among healthcare professionals and increased mindfulness. However, the review is noted to have only included controlled studies published before 2018. Finally, Spinelli and others in 2019 completed a meta-analysis of 38 RCTs, which focused on the effect of mindfulness on both qualified and trainee healthcare professionals. The review highlighted that mindfulness helps significantly reduce anxiety, depression, psychological distress, and stress levels. Although the effect was smaller, significant reduced burnout levels were also observed. The review highlighted the importance of assessing participant needs prior to selecting MBI type, and the future studies should focus on measuring changes in mindfulness and include active controls. However, only RTCs published before 2018 were included in this review. More systematic reviews and meta-analysis have not quality assessed a number of existing studies in their reviews due to their focus being on controlled studies and depending on the similarity of outcome measures, so that meta-analytic procedures can be completed. Since the completion of the aforementioned reviews, additional studies have been published in this area. Therefore, the systematic review aimed to examine controlled and uncontrolled quantitative studies that investigated the effectiveness of MBSR on psychological functioning of HCPs more broadly. In addition, the systematic review also examined additional factors that may have influenced MBSR treatment outcomes, namely the nature of self-selected samples, the level of mindfulness home practice, participant incentives, and treatment dosage and duration, robust theoretical frameworks, and how they apply to the role of mindfulness to healthcare professionals were also considered.